Hello, this is Dr. Bob, Dr. Kaysen, and Dr. Anthony DeMaria, and thank you once again for joining us for this Half Off Health program. And we have a lot of very exciting information. I know that some of you have read magazines. You get a little bit confused about what you should and you should not be doing. And maybe sometimes people will listen to their very best friends and will give them advice, some health-changing advice that maybe not always is correct. I know ladies that are watching us right now that you are the decision maker in the family when it comes to healthcare choices. Oftentimes we find that men, especially for myself personally, I found some of the most challenging patients that I had that come into my office are men between 25 and 45 years old. And I believe that is just because of our culture today. So we're here to make a difference. People have choices to make, and oftentimes those choices can be manipulated by magazines and TV, and we are in the trenches. You can say, what does that mean, Dr. Bob? We see patients in our office, real patients that have real problems, that have been everywhere, have had a variety of opinions, and they come in office oftentimes post-surgical. So our goal right now is to help prevent that. You know, recently we had someone come into our office that had chronic lesions in their mouth that nobody could figure out what's going on. And then after we did a variety of tests and assessed them, we made appropriate and necessary recommendations. And this individual was so excited that their lesion of cancer, which was on the side of their head here, skin cancer, was going away. You said, Dr. Bob, do you help skin cancer? No. What we do is we help the body heal itself. So when Dr. Anthony and Dr. Kaysen and myself give you an opinion and make recommendations, it's not about us. It's never about us. It's about natural principles that we've been blessed to learn. You know, they thought Jesus was a little crazy when he had someone put mud in their eye. Hello, and the guy's blindness went away. And so we're just here to put a little mud in your eye. That's what we're here to do, right?
I think one of the things that you said is really the most interesting thing, and something that I really want to convey with Dr. Bob and Dr. Kaysen today, is the healing potential in your body that's in every single one of your bodies that are out there. And some of you have been trained not to think like that. You've been trained to say, well, there's something wrong with me. Well, there's nothing wrong with you. You might just have interference or subluxation or an impingement in the brain's ability to communicate with the body. And one of the things that we use in the office is we talk about how your nervous system acts like a set of breakers or wires, because everything comes back to the spine. Every organ in your body has a nerve that's connected to it. So one of the things that's really important with that circuit breaker to understand, just like the circuit breaker that goes to your refrigerator, if the circuit breaker's off, over time the food that's in your refrigerator is going to spoil. So if your circuit breakers are off, your vertebrae are out of position, that's what we call a subluxation. And then those subluxations can cause dis-ease or symptoms to manufacture in your body. So one of the things that we really want to get you to understand is that your body has the healing potential inside of you. And we like to unlock that healing potential when you come and visit us at the office. A lot of times people say, well, Dr. Kaysen, Dr. Anthony, or Dr. Bob, you guys are the best healers that there are. We don't do anything besides what we've been trained to do and allow your body to heal itself. And that's where the true power of health comes in, is in you. So what I would like you to do is I'm going to have you call a friend. I'm going to have you update your Twitter or Facebook status saying that you are watching Dr. Bob right now, Dr. Anthony and Dr. Kaysen. He's giving you insightful information about how to be healthy. And you can check us out on Facebook for more information on some of the things that we're talking about here today.
And your body does heal from the inside out. And I've been practicing since 1978. And what's going on right now in our society is posture is pitiful. And a part of that is because people are not active. There's a layer of people that are active. But most people, Dr. Anthony and Dr. Kaysen, when I travel around, if you're on an airplane or anywhere, guess what they're always doing? They're doing this. Their heads are always down. And what that causes, it compresses the spinal cord. So what Dr. Anthony is saying, he is like spot on. If your nervous system is out of alignment or your spine's out of alignment, compressing your nervous system, that shuts off power. And we have the ability in our office with some very sophisticated equipment that we could literally take. It's like CSI. We could literally take a temperature picture of your body with this infrared scanner, put the information into a computer, and it gives us a picture. I mean, it is so uncannily accurate. It gives us a picture. You know, it's awesome, isn't it?
It is. I love seeing people's faces when they see. I mean, when you see what this picture should look like, and then if you see your picture, and if it's not functioning how it should, you can see exactly where it's literally being choked off. Your spinal cord, it will show red, and then you'll see the blue, and then you see that spot where it's just being choked right off from that subluxation. I think that's been a real eye-opener for everyone in our office, and even for us learning just how amazing our bodies are when they're unlocked and when they can express their full potential.
You know, and Dr. Kaysen says learning, I think that every day when we have patients that come into office that are new patients, and we do our intake, what we call OPQRST, that means we're asking you questions, and we do our assessment. I think all of us, when we have people, we can figure out most items just talking to people, but when we see those x-ray results, that really is wild, isn't it?
I know. I think it's really exciting. I think just the other day, I had a woman in the office, and she was having numbness and tingling in her lateral, so her outside 2 fingers. And I said, I know that the nerves from your lower neck go to your fingers and into your hands, and I bet that you've had previous trauma, accidents, or falls, or you have something going on in your lower spine. And she was saying to me, well, how come no one's ever told me about that? I've been to a medical doctor, I've had this and this done, and just going on. And she said no one's ever told her about her spine, but it completely makes sense that the nerves in your spine go into your arms.
You know, it's kind of interesting because we had a prior guest that was on the program here, and her liver enzymes were like way out of the ballpark, and her healthcare provider said there was nothing that they could do to go home and live with it. So you know that person that you were talking to. Mm-hmm. It's almost like I feel that the medical community, and I'm not here to beat the medical community up, it's almost like they become detached from reality. I mean, we actually touch people when they come into the office. It also amazes me how many people have not even been in touch by the healthcare provider. So you mentioned wrist, and Dr. Anthony has this model here. Let's talk about this arm and hand.
One of the things that we always like to talk about, besides the body's ability to heal itself, is how everything is connected. So one of my takeaway messages for you today that is watching is to realize that everything is connected. So this is an arm bone, and just like your arm that you could be looking at right now, there are muscles and ligaments attached to all of your arm. But to each of those individualized muscles that do specific motions in your hands have nerves that are coming from your neck to your arm. So one of the complaints that we have, people will come in and they'll say, you know, I have carpal tunnel syndrome. And one of the common things that we find is that people that get carpal tunnel syndrome surgery still have the symptoms after the surgery. And you could say, well, why do they get the surgery? It's because the carpal tunnel syndrome wasn't the problem. It was coming from the misalignment of their spine and the neck, which was the root cause of where that nerve actually came out. So I know that we had a patient in last week, and Dr. Kaysen and I were working with her, and we asked her some questions about what was going on, as we would if you were to come into our office. And one of the things that we were able to educate her on was that the symptoms that she had in her hands were coming from her neck. We pulled up her x-rays, we were able to talk with her, and she got the big idea, as our hope would be for you to get the big idea that everything is connected and that your body has the potential to heal itself.
Oftentimes, what we'll also see is if somebody has a carpal tunnel, they could have misalignment of their elbow. And you know, the outer elbow they call tennis elbow, and the inside of the elbow is called the golfer's elbow. But I know I had a patient came into office that had her arm surgically screwed up 12 times. They did 12 entrapment surgeries to her to release the nervous tension that was going on. And it was so sad because the woman came in and had all these scars on her arm. And so I'm going to share something with you right now that you may have maybe never heard before. It's exactly what Dr. Anthony was saying, but I'm going to take it to another level, okay? I've had patients come in that have had carpal tunnel surgery twice to both wrists. We're scheduled for a third surgery. Nobody ever looked at their neck. Now, I know that there's somebody watching me right now that's had that done, because if they've come in our office like this, I know that one of you out there are scheduled right now to have carpal tunnel surgery. And I am not telling you that you should cancel your surgery, but if it was me, I would at least come in, have an opinion, let us assess you, go through a course of spinal correction, and if your symptoms go away, thank you. But if they don't go away, guess what's going to happen? They're going to operate on you anyways. So we have found that we can help you. We actually have a tool called a JMAR dynamometer. There is so much technology out there today that we could check your grip. Dr. Kaysen and I were talking at the beginning. We could do a thermography, a temperature assessment. And what's very unique about our practice, now, I want you to think of us as the drugless doctors. That's what we are. Drugless. No drugs. We help people get better. But what is so unique about what we do in our practice is that we have motion-specific chiropractic systems. That means when you come into our office, you go through life moving. So we will take motion films of your spine. It is so unique what you do because we can find the exact vertebra or multiple vertebrae that are out of alignment or subluxated, make the appropriate and necessary adjustment to that vertebra. We could literally reassess you with a thermography and see changes. And we could see changes that are predictable over time. So this is not about throwing the dice, as I know one of Dr. Anthony's favorite Bible verses is in Proverbs, is about the Lord, you throw the dice and the Lord gives you the lot result. Our goal is to create a plan. This is not a wild goose chase. So you could possibly come into our office, have chronic low back pain that's caused by subluxation in your neck. You could come into our office and have left neck and shoulder blade pain that's caused not only by subluxation in your neck, but what you're eating. So stay tuned. We'll be right back. Hello, this is Dr. Bob, Dr. Anthony, and Dr. Kaysen DeMaria. Welcome once again, and welcome back to our Half Off Health program. Probably the most significant item that you should be learning from us right now is that your body has the innate ability to heal itself. We don't heal anybody. What we do is that we help your body fulfill the God-given potential that you're created to do. See, when God breathed life into Adam, he told him to multiply. Multiply means just be good, create the whole Garden of Eden throughout the world. Somewhere along the line, we had some major challenges and the devil stole everything away. We're here to give you the good news. Your body has the innate ability to heal itself. We just have to make sure that there's no interference. And unfortunately, when I first started practicing back in the 70s, before some of you were even born, we did not live and have to deal with the toxic stress, the toxic food, the toxic water that we're living with today. So our bodies are almost maxed of with their capability. And if you have a vertebra that's out of alignment because you're sitting on the couch and you're not active, you're not exercising, you're going to have impairment. Well, Dr. Kaysen's going to give you a little nugget that I know that some of you have been suffering with for years. And this is going to be the epiphany and the moment of truth that you've been waiting for. Right, Dr. Kaysen?
Yes. Okay. So many of our patients, they come in, and even people that we're meeting out in the community, they have left mid-back and left upper back pain. And that pain is actually coming from the foods that they eat. Our number one culprit are bananas. Bananas can cause left mid-back and upper neck pain due to just the referral pattern of where the pancreas is. Also, other things that can cause mid-back pain are grapes, berries, yogurt, sugar. I know we have a little joke in the office. We can tell people that they're eating sugar or chocolate or ice cream, because really you can feel their muscles and you can feel the tightness in that left upper back pain. And I know that just recently I met someone